You will receive a phone call from one of our OR staff members on the day before your surgery. They'll provide you with information about your surgery time, when to arrive at the hospital, and final instructions on when you should stop eating or drinking before your surgery. Do your best to get sleep ahead of your surgery. We understand this can be difficult when you're having pain. You may receive some medications to take before your surgery to help with pain control for your surgery. If you're given medications, you will also receive instructions on how to take them. Please follow these instructions carefully. You will not need to pack very much when coming in on your surgery day because you will not likely be staying here for very long. We provide a belonging bag for minimal items. We ask that you keep additional bags and belongings in your vehicle until your arrival into a room on the inpatient unit. There will be carts and extra hands available to assist you. We recommend wearing loose-fitting clothing and having a pair of comfortable walking shoes to the hospital. You should bring a clean and comfortable pair of athletic shorts, warm-up pants, or sweatpants, and a comfortable t-shirt to wear after your surgery. If you want to purchase your discharge medications from our pharmacy, you should bring insurance cards, prescription cards, as well as a form of payment for your medications. If you're going to spend the night, you're welcome to have one visitor stay with you as long as they're 18 years old. One of our inpatient wings has a recliner, and the other has a fold-out couch for visitors to use if they stay with you. Our nursing staff will take good care of you while you're in the hospital, but having someone with you will help you to remember the instructions you receive from doctors, nurses, and therapists. Your surgery and anesthesia will keep you from being able to attend to small children in your room. If any visitors bring smaller children to the hospital, they need to be fully responsible for them while they're visiting. Surgeries at the Missouri Orthopedic Institute are performed on the ground level or first floor of the hospital. When you come to the hospital, we suggest that you come to the Circle Drive or valet parking at the front of the hospital. You will be entering the building on the second floor. Take the first set of elevators on the left to the first floor. The surgery check-in desk will be immediately to your right when you get off the elevator. If you come in from the parking garage, you will be entering the MOI on the second floor. After crossing the bridge, you will turn down the first hallway to your left. Follow the signs to the clinic check-in desk and the outpatient pharmacy. Turn left in front of the pharmacy and take the elevators on the right-hand side down to the first floor. The surgery check-in desk will be immediately to your right when you get off the elevator.
Thank you for allowing us to help take care of you. We look forward to making this a positive experience for you and helping to improve your pain and quality of life.
If you have any questions about the information we provided you today or any things that we did not specifically address, please feel free to discuss those with a member of our education team, your surgeon, or another member of your surgeon's team.